Hi everybody, Ziv Simon here. I'm the creator of SurgicalMaster, the surgical training for dentists. Welcome to another video. And in this one, I'm going to talk about Chow's pinhole surgical technique, which is a procedure to treat gum recession that I incorporated into my practice in the past year and a half, at the time of recording this video. Just to clarify, this video is not meant to teach the actual technique. Currently, it's only taught at the Pinhole Academy, where you can get the training from Dr. Chow. And my goal is to share my experience with this procedure and also create some discussion in the SurgicalMaster community. So when we talk about gingival recession, which is a very common problem among our patients, there are so many ways to treat this problem, and we have so many different options. So when you think about root coverage treatment, there are two main approaches that you can offer your patients. One would be with a free graft, and that's harvesting a tissue from the patient's own palate or getting tissue from a tissue bank. And the other approach is a type of tissue manipulation called a pedicle graft, where we will manipulate the flap to cover the receding roots. And very commonly, we use a combination of the two. Now, the palate as a donor site has been a problem forever for patients. Patients complain about that. Although we improved our techniques and we're getting better about harvesting tissue from the palate, but it always hurts, and some patients will tell you that you have no permission to touch their palate, which I encounter in my practice as well. So over the years, a lot of other less invasive techniques were developed, and they involved the coronally repositioned flap, mobilizing tissue with good quality over receding roots. We use tissue from a tissue bank using allograft material with or without a tunneling approach. And we also incorporated growth factors and different tissue engineering principles to make the grafting process much more, let's call it palatable for a lot of the patients, so they can tolerate it and they consent to treatment. One of those less invasive techniques is a procedure called the Pinhole surgical technique that was developed by Dr. John Chow from Alhambra, California, and it's called Chow's Pinhole surgical technique. It is a trademark, or Pinhole gum rejuvenation, also trademarked, or simply PST for Pinhole surgical technique. I first met Dr. Chow in 2010. We were both flying to the AAP annual meeting in Hawaii. We were sitting next to each other. And during the flight, he showed me a manuscript that he wrote, an article about the pinhole surgical technique that he submitted for publication. And in a very short time during the flight, I thought this idea was very interesting at the time. So it took about 2 years later, when this article was published in the International Journal of Peri and Restorative Dentistry. And this time I could read more about the pinhole surgical technique and John's experience and some of his long-term follow-up. This is a procedure he invented and developed in his own practice over many, many years to address the need of his patients that had gingival recession and did not want to have tissue harvested from their palate, and developing a technique that will be relatively simple and safe to help patients with recession. So about a year later, in August of 2013, Dr. Chow conducted the first PST course in his practice in Alhambra, California. At the time, we were 8 periodontists, 1 orthodontist, the rest were general dentists. And we were really the first doctors in the world that trained in the pinhole surgical technique under Dr. Chow. So it was a hands-on course. We learned all the details about how to perform it, how to bring it back to our practices as a non-invasive way to treat gum recession. Now, at the moment, this procedure can only be taught at the Pinhole Academy by Dr. Chow, but you can also look up his website and get some more information about the training and watch some videos on how this pinhole is being created and the use of specialized and patented instruments that mobilize the gum tissue and help patients with recession. Now, ever since this course, I incorporated the PST technique in my practice, I wanted to share a little bit of my experience. Now, my first patient was referred by Dr. Chow. She actually was living next to my practice, and he very kindly referred her to me. She was an 80-year-old woman with significant recession. There was a little bit of decay on the root surfaces that needed to be removed. And the procedure worked out quite well, with no complications, relatively uneventful. And she was very happy with the results. I actually encouraged her to do some more bonding to correct some of the aesthetic problems. So 80 years old. So after this case, I started to get more and more experience with the pinhole surgical technique, and I found out that patients are recovering relatively quick. There are not too many side effects. There's definitely no problems from the palate because we don't use a donor site. And I also found it to be a safe procedure with a very low risk of perforation. So as I was gaining more and more experience, I was treating more patients and more teeth in the same patient. And in this case, I treated the full maxillary arch with recession. We're dealing here with the natural dentition. And at some point, I was ready for my picky Beverly Hills patients with very high aesthetic demands, and also treating patients that have existing restorations with gingival recession. Now, some of these cases are challenging regardless of what technique you're using. In this case, there were three main challenges. Number one, there was recession on an upper molar with the frucation starting to show, and that's usually a problem because tissue adaptation is a problem regardless of what technique you're using. I was also dealing with poor tissue quality, and this recession site was close to a pontic, so my ability to mobilize the tissue was very limited. So this case worked out very well, and my patient was happy, but I was not able to get the full root coverage on the molars for the reasons that I mentioned before. So I started to use this procedure for my aesthetic cases wherever it's indicated, with very good results, very little complications, very little side effects and problems. And this procedure also got a lot of media exposure. Dr. Chow appeared in many interviews, and the procedure was featured on several TV shows. And what it did, it created some interest among our patients with recession. It increased their awareness, and patients started to call and ask for this procedure, which was really great. Now, the pinhole procedure also got a lot of attention from the professional community, and in the American Academy of Periodontology, it was a very commonly searched term, and there were a lot of elaborate discussions online on different forums. And when I participated, I definitely spoke about my positive experience with the pinhole and how everybody who is involved with treating gingival recession should be aware of it as one more tool, one more surgical tool in treating gingival recession. So in conclusion, in my experience, the pinhole surgical technique works very well. It's very effective. It's very safe, with very few complications and side effects. Patients' acceptance is also very good for that reason. And if you are interested to learn more about it, you can look up the Pinhole Academy and get involved with their training. And if you like this video, feel free to share it with your colleagues and friends. And go to my website, SurgicalMaster.com, opt in, so you'll get my weekly videos and blogs so we can learn and get better. And I look forward to seeing and working with you in the future.